Hello everyone, I'm Dr. Bhavya Jha, IVF consultant at Apollo Miracles IVF, Gurgaon. And today I'm going to talk to you about infertility in general and who requires IVF. So what is infertility? Infertility is when a couple is trying to conceive for more than 1 year without using contraception and is not been able to conceive since 1 year. And other people who are more than 35 years of age and have tried for more than 6 months without contraception and have not been able to conceive naturally. Then we grade them as infertile couple. And once you realize that you've tried for more than 1 year and have not been able to conceive, you must take the step of going to a fertility doctor. So when you come to a fertility doctor, we get a series of tests and trying to understand where the problem lies. So for women, we usually go for a scan, baseline hormonal tests, tube testing and internal examination. For males, the basic test that we do is a semen analysis. With this much of profile, we do get to know where the problem lies, and accordingly we can provide multiple treatment options to help you conceive pregnancy. And you must not think that when you are walking into a fertility clinic, you will be pressurized to go for IVF, because IVF is not required by every patient. Most of our patients conceive naturally with few medicines, with follicular monitoring, with few surgeries, maybe minor surgeries, and IVF is not required by all. So what are the problems of infertile couples, what the causes of infertility are. So basically for women, very common ones are PCOD, there is advanced age, obesity, then endometriosis, then there are women who have very less egg count. Because of that they are not able to conceive. Then there could be tubal blockage, so fibroid uterus, adenomyotic uterus, thin endometrium. So these are the common problems which women are facing and not able to conceive. For males, it could be ejaculatory problems, or there could be problem in the semen analysis, poor count, morphology or motility of the sperm, high DFI. So these are the common ones which we see. So once with the test and other history, when the problem is diagnosed, we try to give the treatment according to that. So we can offer the basic treatments such as ovulatory drugs, and then followed by some ultrasounds. Even with timing the sexual intercourse at the right time of ovulation, lot of our patients conceive. And with just adding minimal support with hormones also, lot of our patients conceive. So all we need is to take that help from the doctor. Then coming to the next treatment option is IUI, where we do help. That does help in patients who have poor sperm count, and with the processing of the semen sample, we try to give them a pregnancy through IUI. Even in the anovulatory cycles, where we do the follicular studies for an IUI, we are able to help the patients. Then the third option that we give is IVF. So IVF is usually the last resort. Mostly we try to help the patients with basic treatments. IVF, usually it is a 1 to 2 month treatment cycle, and 10 days injection is given to the women. All the eggs are taken out of the body and husband's sperm is taken, and embryos are created in the lab. We grade the embryos, and in the next cycle we try to make a good endometrium lining of the uterine cavity, and then at the right time we transfer the good embryo inside the uterine cavity, and through that patient is able to achieve pregnancy very quickly. So these are the basic treatment options that we give. And whoever is suffering from infertility should not sit back and come to the fertility clinic and seek help. Thank you.